This short film is for patients in North Central London who may need planned orthopaedic care from a hospital specialist. That is care of their hips, knees, shoulders, elbows, feet, ankles or hands. If you need this kind of care, you have a right to choose where you go. Most people choose to go to their local hospital, but you could ask to be referred somewhere else in London, or even somewhere else in the country. You can choose between NHS hospitals and private hospitals that provide these services on behalf of the NHS. You'll find more information on the NHS website. This film focuses on Barnet, Camden, Enfield, Haringey and Islington, where NHS hospitals are working in partnership. Working together in this way means patients can receive timely, high-quality care. Clinicians from across hospitals will work together, have joint training and education, and hospitals can share their facilities, which will open up access to more dedicated beds and operating theatres. Your appointments will be with the same surgeon who, with their team, will stay with you throughout your care, regardless of where it takes place. If you do need surgery, it will take place in state-of-the-art facilities with access to high-dependency care. Anyone having a hip or knee replacement will be offered education classes to help them prepare for their surgery and rehabilitation support afterwards. You will also be offered the support of a care coordinator, a named contact at the hospital who can help you and answer questions. This may be particularly helpful for those with dementia, learning disabilities or long-term health conditions. So, what are your choices? A partnership has been formed by University College London Hospitals and Whittington Health, with clinicians from both trusts working as one team. In this partnership, you can choose between University College Hospital or the Whittington Hospital for your outpatient appointments. If needed, day surgery could then take place at either of these hospitals. However, if you needed surgery that requires a hospital stay, sometimes called inpatient surgery, it would take place at University College Hospital Grafton Way building, regardless of where your outpatient appointment took place. Another partnership is between North Middlesex University Hospital and Royal Free London Hospitals, with clinicians from both trusts working as one team. In this partnership, your outpatient appointments could be at Barnet Hospital, Chase Farm Hospital, Edgware Community Hospital, Finchley Memorial Hospital, North Middlesex University Hospital, or the Royal Free Hospital. You can decide which of these you prefer. If needed, day surgery would take place at Chase Farm Hospital or North Middlesex University Hospital, depending on the hospital you choose for your outpatient appointments. If you needed surgery that requires a hospital stay, sometimes called inpatient surgery, your surgery will always take place at Chase Farm Hospital, regardless of where you had your outpatient appointments. Whilst the majority of your care will take place at the hospital you choose for your first outpatient appointment, that choice does influence where you would have surgery if you need it. That's why it's important to choose carefully. There are a couple of exceptions. If you have another medical condition that needs specialist care, you may also be advised to go to a different hospital. If your surgery is more complex, you may be referred to the Royal National Orthopaedic Hospital. If either of these apply to you, your clinical team will discuss this with you. When it comes to making your choice, you don't need to do this on your own. You can ask the advice of your GP, physiotherapist, or other healthcare staff. We would encourage you to ask lots of questions and consider what is important to you. For more information about your choices, visit our website or talk to the NHS staff involved in your care.